Woodcock, the seems to me the most important thing about this bill is the new category, compounding manufacturer.
That's right.
And to me, clarity is what the flagpole is what I'm looking for. And a compounding manufacturer would be one that makes a sterile product in advance of a prescription and sells it across the state line. So if you do that, you're in that category, right? Is that the way you understand it?
Yes.
And then the compounding manufacturer would be inspected by and register and list their products with the FDA.
That's correct.
Now, what we're recommending, the draft recommendation is that you be totally in charge of that facility. You be on the flagpole for that facility. But your testimony suggests that the state have some role too. Doesn't that just leave us where we are, which is confusion between what the state, can't you then say, well, the state should have done that, and they can say, well, I thought the FDA was doing it?
No, we would take full responsibility. However, we feel that this is a pharmacy operation. All right, it's almost like a federal pharmacy operation in some senses. It is a pharmacy operation because what would keep a traditional manufacturer, okay, if they don't have to be a pharmacy, all right, then they say they're a compounding pharmacy and begin to make perhaps unapproved drugs. So the rationale for this third category is really that these are pharmacies that are doing operations that are beyond the scope of ordinary pharmacy practice,
right,
and really need federal intervention. But they still are pharmacies. They're still doing pharmacy operations.
Well, the bill requires that they have a licensed state pharmacist in there, but
yes,
why shouldn't it? That's confusing to me. I mean, it seems to me that it's important for a facility to know that if I make a sterile product in advance of a prescription and I sell it across the state line, I've got one regulator, and that regulator is the FDA, period. And then the doctor knows that, the customer knows that, the patient knows that, everybody knows, and the FDA knows that it's your job to make sure that place is safe.
and we agree that we would take full responsibility that the registration and listing provisions that you put in the bill enable us to know who those folks are.
Yeah, but then why do you need to have the state involved?
Well, it's on the other side, like of the people who are traditional manufacturers, which distinguishes this facility
Traditional
from any
manufacturers or pharmacists?
traditional manufacturers. So it's the other side. It's not the pharmacy that is.
Well, you
confusing.
regulate traditional manufacturers.
We do. Well, I believe we could have more conversation about this. I understand.
To me, it's very important. I mean, I think Admiral Rickover was onto something, and we could probably apply it in a lot more aspects of the federal government. And I mean, I've just in my human experience, I've discovered that if it's absolutely clear who's on the flagpole, who's in charge, that reduces the risk of failure, and it improves the chances of success. And I'm more comfortable with your being in charge of compounding manufacturers, just like you are with traditional manufacturers, so there's no confusion. If I can ask one other question, the draft bill includes an exemption to the compounding manufacturer category for interstate shipments within a hospital system. Now, could you comment on why you believe interstate shipments of sterile products within hospital systems don't pose the same public health risks as other compounders?
They pose certain risks, and certainly intrastate shipment of sterile products and sterile products that are used intrastate alone pose certain risks, and certainly non-sterile products certainly have caused deaths. So making medicines and shipping them around is not without risk. We've tried to pick the highest risk category, which is where a manufacturer not associated with taking care of the patients, right, is manufacturing products, sterile products, and shipping them all around to other entities.
But why would
a hospital system is already in charge of their patients, and they may wish to centralize their pharmacy operations, but if they had a pharmacy operation, say, in one state, that would be within that hospital system, that would they would be doing that and giving it to their own patients. So they already have responsibilities for the care and safety of their patients within their hospital system.
Thank you, Mr. Chairman. The Chair, can you contract that? What if they contract that out? Does
What if
that
the hospital system
What if the hospital
contracted it
system
out?
contracts?
If they contracts it out, then it's to a different entity, and if that entity is shipping interstate, then that is a compounding manufacturer,
So
yes.
that falls under you,
Yes.
that gets it out. If they contract it out, it becomes outside the exemption, and they're regulated by the FDA.
That is correct, and that is what much of these operations are. There are are outsourcing operations that once occurred in the hospital pharmacy
Yeah.
to sort of
But if Vanderbilt
large-scale
Hospital has its own
hospital pharmacy.
hospital pharmacy, and then in all the parts of the Vanderbilt Hospital, it's exempt from this.
That's
If it contracts it out to the Harkin Incorporated, then Harkins or Alexander are regulated by the FDA.
That's how we understand the current proposal, and that's what we
Well, I
would
hope we
agree
make
with.
that clear in our draft, yeah. Okay.
Thank you.
Thank you very much. In order, I have